have to ask the question regarding the medical research, is this the best treatment for knee arthritis right now? Nobody's talking about this in the research, and then they'll say this dreadful comment to patients that sticks in their head the rest of their life. Come back and see me in 5 to 10 years and I'll replace your joint. I'm gonna probably upset a lot of people. This is brutally honest advice to help avoid a knee replacement surgery. Number one is don't strengthen your quads. Everyone wants to strengthen quads. Everybody tells you to strengthen your quads. And at face value, they think that because it's the muscle that's right above the knee joint, that it's the one that you should strengthen in order to help any knee problem, especially like a knee arthritis problem, an osteoarthritis problem. But in fact, it just makes it worse. And a lot of people don't get this, but when you get stronger quads, the quad's attached to the kneecap, right? So it's going to pull the kneecap up, which smashes the kneecap against the thigh bone. And then there's a tendon that comes off the bottom of the kneecap that attaches to the shin bone. So it pulls the shin bone up into the thigh bone. So it just compresses the entire knee joint and makes the knee arthritis worse. That's exactly how it happens. And people just don't get this. They just stay on the superficial level of, well, that's the closest muscle to the knee. I need to strengthen that muscle. But it's not really well thought out when it comes to what exercises to do to help knee osteoarthritis. And I think most people know this deep down inside because they'll go do some quad exercise. They'll go to the gym and they'll do knee extensions, the one that has a pad in the front of your shins and you straighten out your knees like this. And you feel the burn in your quads. So there's that feedback of like, oh, I'm working out my quads and I'm doing a good thing. But then you also feel that compression, that pressure, that even discomfort in the knee joint. And as you go along more, especially if you're doing this over weeks, months, it kind of gets worse to the point where it's no longer a discomfort, but a pain. And if you're already flared up with knee osteoarthritis, like you're probably going to be like, hell no, I'm not going to do this exercise. Like I know it's going to hurt me. But for somebody who's got mild knee arthritis or like has been having knee pain that comes off and on over the years, they feel it as they get stronger in their quads because they're usually trying to do good. They're trying to follow the advice of healthcare professionals that told them to work out their quads, fitness trainers, or they research stuff on the internet. And they saw you need to work out your quads. And so they go do that, trying to be a good person and follow the best advice. But then they feel that discomfort inside their knee joint and they hold it inside and they think to themselves, well, maybe it's supposed to feel this way, or maybe I'm doing it wrong, or maybe, like they have all this questioning that goes on inside and they just keep going because they're not sure how it's supposed to feel. And truth be told, most medical professionals aren't even sure because they're doing the same thing. They're out there working their quads, helping their own knee problems. I see them. I treat them. I know this. And they're doing it wrong. And when I explain to them how the quads pull up the kneecap and the kneecap pulls up the shin bone and it smashes the whole joint together and just wears down the cartilage even faster, it's like the light bulb goes off in their head and then they're like, wow, I've been telling everybody wrong. I'm going to stop telling people to work out their quads. So that's number one. Don't work out your quads. Not a good idea. Number two, here it is. Medical research is highly focused on treatments surrounding medications, injections, and surgery when it comes to knee arthritis and replacing the knee joint, like getting a knee replacement. And there's a lot of databases out there. And for those of you that aren't, like, if you're not into the medical research stuff, which you don't have to be, but there's going to be some people watching this video that I think are, you can go on Google Scholar. It's completely free and get access to tons of research articles. And if you do have access to other research articles like EBSCO or SINHAL, there's a bunch of medical databases out there where you can do searches like operative treatment for knee osteoarthritis. Search that, and you'll probably find somewhere between 800,000 to 1 million research studies on operative treatment for knee osteoarthritis. But then contrast that with the search for non-operative treatment for knee osteoarthritis, and you're lucky if you find 100,000. Maybe depending on the keywords and all that, you may get to 200,000, but it's not that much. So literally 9/10 of the medical research out there is surrounding medications, injections, and the surgeries involved with treatment of knee osteoarthritis. And only 1/10 is about treatments that help you treat arthritis without surgery. And I can tell you from research, and I'm a physical therapist myself, I look at the research on a consistent basis, and the research that's available for non-operative treatment is not great. It's highly varied. The exercises, the treatments, the techniques, the all the things that you see in there, like there's very little consistency in how they're doing the treatments, which makes it difficult to progress the knowledge base on this. And so I personally don't rely on the research too much. I do use it. There's definitely some good research out there, but I can't say that I would trust all the research and follow it and apply it to all of my patients because it's so poorly done. And what I'm not saying is that we suck at research. That's not what I'm saying. I think there's very smart people out there, extremely smart medical scientists doing this research. The fact is, though, that we're in the Stone Age when it comes to knowledge about medicine and the human body and how we're supposed to heal and the way that things are supposed to progress as we heal them or as they decline because of some condition like knee osteoarthritis. But what you don't realize, like nobody talks about this, but it was just, I have it right here in my notes, it was just over 100 years ago that surgeons were doing lobotomies. If you don't know what a lobotomy is, it's where they pierce your skull somehow, sometimes through the nostril, sometimes externally, different ways where they do this. And they would do something to your brain, sometimes remove a chunk, sometimes switch it around, sometimes just poke it. And this was the treatment done for psychiatric conditions, even things like headaches and depression. They thought that what happened is, I'm sure the surgeon just got to the point where they're like, we tried this medication, we tried this, we tried that, let's poke a hole in the head and see if we can make it better that way. And somehow it became acceptable. And many doctors were doing it and it was okay. And then they started to realize how terrible it was. And they don't do it anymore, obviously. They've learned more since then. But fast forward to the 1950s, and there was this drug that came out, and it was being used. It's called thalidomide. It was used for pregnant women when they're in their first or second trimester and they're dealing with morning sickness. Thalidomide took care of it. But 10 years passed. It wasn't until the 60s that they found out that it was causing massive birth defects. I mean, babies were being born without arms and without legs, and they were still decently functioning, but they were severely deformed. So they stopped using thalidomide. Even hand washing. Hand washing has only been around like 100 years. I mean, the Jews were doing it since the Bible times because it was like commanded of them, but it wasn't widespread, really universal until like the 1980s. It was being studied like 100 years ago, and there was still doctors battling each other over whether or not we needed a hand wash. I mean, it seems ridiculous to talk about that, but you can look this up. Dr. Semmelweis was a leader in this. I think he was in the late 1800s, maybe the early 1900s. But this guy was professionally shunned for promoting hand washing. And you would think it is ridiculous now, but that was the thinking back then because we didn't know any better. We just didn't know any better. So I have to ask the question regarding the medical research and knee arthritis and joint replacements. Is this the best treatment for knee arthritis right now? And let me tell you what I'm not saying. I'm not saying that knee joint replacements are absolutely terrible things for you to get. I have recommended patients to go get a joint replacement. There are certain cases where I'm like, this needs to be replaced. I can't help you. But there's a lot of cases. In my personal experience, more than 9 out of 10 cases, like 9.5 out of 10 cases, where I've been able to help them, even cases where they've been scheduled to have a knee replacement and the doctor deemed them a candidate for a knee joint replacement, but they didn't need it. We were able to get them out of that inflamed, range of motion limited state. Can't walk too long because it hurts. Have to sit down, stiff in the morning, uncomfortable all the time, swollen. We've been able to calm that down. And get them functioning well with their normal knee. It just needed to reduce an inflammation. They needed to fix certain things, muscle imbalances, and they can function normal again without ever having a knee joint replacement. The outcomes after knee joint replacement, this still talking about research and the surgery. There's studies being done gradually where they're tracking the contentment of people who have had a knee joint replacement, because there's a lot of people that have a knee joint replacement, they still have some problems afterwards, maybe some hip pain, maybe they still even have knee pain or pain somewhere else, or they're just not happy about it. They'll go back to the doctor will do an x-ray, see what's going on, and then they'll end up with a situation where the doctor says, everything looks fine. The x-ray looks great. I don't see anything wrong. My surgery was fine. And they kind of absolve themselves. They wash their hands clean of helping you anymore because they did their job. They did their very technical surgical procedure, which is great. But what the doctor's not usually saying to you in that moment is, I don't know what the hell else is causing your pain, but I can't help you with it either. And that's what I help people out with. It's muscle imbalances usually. That's what's setting them up. And that's what's not in the research. Nobody's talking about this in the research. And I help people with this all the time. We've been talking about it on YouTube for years. We have programs helping people out with fixing the muscle imbalances. And we get testimonials all the time and people telling us they cancel their surgery and their knees are feeling great and they're back to weightlifting and doing very active things simply by changing the pressures through the joint. It's just not out there. We are in the Stone Age when it comes to research. And if you're seeing a medical professional that's strictly following the medical research, I don't think that's the best person to see. I think you need somebody who's got experience and who's looking at this more closely with a more strategic mind. Now, related to this, number 3 is mainstream medicine, mainstream healthcare professionals. So most doctors you find out there, most physical therapists, most nurses, everybody in the medical field, when you ask them, how should I fix my knee arthritis? How should I treat my knee arthritis? They're going to point you towards having surgery, a knee joint replacement, taking medications, and having injections. That's what they're trained to do. And even physical therapists who are exercise experts, that's like their niche in the healthcare field, their main education is surrounding the rehabilitation of somebody who's had a surgery. They don't know how to handle this problem naturally. They don't know how to help somebody rehabilitate naturally to avoid surgery, avoid a knee replacement surgery when it comes to arthritis. If you're seeing a doctor, a nurse, a nurse practitioner, even a physical therapist, anybody who's helping you with your knee arthritis problem, chances are they're going to point you towards having a surgery, a knee joint replacement, or some procedure, some related procedure, having an injection, or taking medications, because that's what their training is about. I taught in physical therapy schools. I've mentored students. I've mentored even advanced level students. And I see it time and time again. That's their thinking. Their main training is helping people have a surgery or avoid, I say with air quotes, avoid surgery by doing alternative treatments, which is medications and injections. But those treatments are not solving the root problem. They're just treating the symptoms, even surgery. I'll tell you more about that. But if you're seeing a healthcare provider out there and they're not talking about muscle imbalances, they're not talking about avoiding surgery, treatments to avoid surgery, and they're not specializing in that, then I would assume that their main training is going to end up at the end, like when this doesn't work and when this medication doesn't work, that injection doesn't work, and plan C and plan D don't work, they're going to resort to the last resort, which is having a surgery, which still doesn't fix it. I just talked about that with the contentment rates. People are not content with their knee replacements afterwards. Number 4 is you've got to activate your butt muscles. You have to figure it out. Like, this is absolutely critically important. It's necessary. It's the thing, it's a landmark point in treatment that I push everyone to, because if they don't figure out how to activate their butt muscles, we're never going to be successful. It's so critically important. And what I mean, just to be super clear, is like, you're sitting down right now. Can you, in a seated position, tighten your butt muscles? Like, you see how I'm going up a little bit like that? That's evidence to me that your butt muscles shortened and they firmed up, which the medius part of it thickens and it makes you elevate. And then that's step one. Can you just activate your butt muscles and hold it a little bit? And then step two is, can you do it without also tightening up all your thigh muscles, the front of your thigh and the back of your thigh, the quads and the hamstrings? Because that's the second thing that people often have to figure out. First is just, can you get the butt muscle to tighten? Some people will try to do that and they're like, oh no, it's all thighs, no butt. Okay, let's figure that part out. Then the next part is, okay, you got the butt muscle working, but can you do it with your thighs quiet, without your thighs tightening up so much? And think of it in percentage terms, like, can you get to 100% glute muscle butt contraction with very minimal to nothing in the thighs? Oftentimes people are like, okay, I'm like at 50% glutes and my thighs are going just as hard or almost as hard. You've got to separate that out. If you don't crack that, you will never improve, because the glute exercises that come in the progression of exercises that you have to do in order to fix knee arthritis require you to isolate the glutes. And if you are firing your thigh muscles every single time you try to do this one glute exercise, you're working against yourself. You're just adding that compression to the knee joint, and you're just going to get worse. This is why people say, well, I was unsuccessful with these exercises. I tried doing the exercise. I went to therapy. I tried even doing my video, the YouTube videos that I put out on online, and they'll say it hurt me. It's usually because they haven't gone through this important step of, you need to make sure that your glutes can fire independently from your thigh muscles. Number 5 is figure out how to get your butt muscles stronger. So it's the progression here, because you have to make it your mission. Once you figure out how to just activate the muscle, and then how to not also fire your thigh muscles so much, the next step, the third step after that, is make sure that you can tire out the glute muscle. Because if you do that on a consistent basis, then you're going to get it stronger. And if you're fixing the glute muscle strength, then you're going to be reversing the muscle imbalance, which decreases the pressures in the knee joint and allows it to calm down, to not swell, to not hurt when you stand on it, to be able to allow you to walk for longer periods of time. This is what people don't figure out. They go get on a bike, they go walk for exercise because everybody says walking's amazing and you should walk. You have knee arthritis, go start walking. But if you're firing your darn quads every step you take or every pedal of the bicycle, and you never figure out how to get your glutes to work properly, you're just digging yourself a deeper hole, and it's going to get worse. Happens time and time again. People say, yeah, I went to physical therapy, spent all this time on the treadmill, spent all this time on the bike, did all the exercise they had me do. It was all quad focused, whether they intentionally did it that way or not, because that individual never learned how to fire the glutes right. It was unsuccessful. And then the PT's saying, didn't work out, sorry, go back to the surgeon. Then the surgeon says, oh, you tried PT, unsuccessful. Huh, not surprised. And then they're ready to do the surgery on you. And truth be told, I see the people after they have a knee replacement surgery and it didn't work out for them too well. And they're like, I still have knee pain. I still have hip pain. And then we go through the same process of getting their butt muscle stronger, and their pain goes away. And then they're having the moment where they have to realize and swallow the difficult pill of, was that knee replacement that I had actually necessary? Because how the heck did my pain go away after doing butt exercises for a month, and after having gone through all that trouble, months, years of pain and discomfort, decades even for some people, and it dramatically reduced, maybe even went away completely within a month or two? That's tough. That's really tough. The glutes are so important. You have to learn how to turn them on and then get them very strong. Number 6, self-limiting belief about knee arthritis. A lot of people that I treat, they don't have a realization that they subconsciously believe that knee arthritis just isn't going to get better. They think that it gets worse and worse and worse and worse and worse, and it never gets better. This belief is putting them I think subconsciously by friends, family, definitely healthcare professionals. They go see, because doctors will say things like, you go to the doctor for knee pain, for instance, and if you're 50 or over, the chances of you having arthritis visible on your X-ray starts to climb up significantly. And so the surgeon will pull up the light box, that white light where they put the X-ray up, or they'll put up on a screen, probably more if you're in a more modern facility, and they'll say something like, "Look, there's signs of arthritis," and then they'll say this dreadful comment to patients that sticks in their head the rest of their life and keeps them awake at night. They'll say something like, "Come back and see me in 5 to 10 years, and I'll replace your joint." That sticks in your head and gives you that self-limiting belief that it's only going to get worse. Because I'm 55 right now, and how's it going to be when I'm 60, 65 and beyond? And then it's a self-fulfilling prophecy, because you never learn how to do the glute stuff. You never learn how to fix it, because everybody's telling you that the research sucks out there about our knowledge. But we're in the Stone Age, and they're telling you it's just going to get worse. And then they're saying these other words that stick in people's head. These are all the self-limiting beliefs I'm calling out for you. It's an age-related condition. Complete baloney, complete BS, excuse my language. I yell at my patients angrily, with love, not to believe that, because it is not an age. How can I help somebody who was on the schedule with the surgeon to have a joint replacement in their 70s? We did treatment like we always do with everybody else, glute focus, take the pressure off the joint, muscle imbalance stuff, and then they're better. Time elapsed, they got older technically, but they're better. It is not an age-related thing. It is a joint pressure thing. And if you fix that joint pressure, regardless of your age, as long as sure, there's situations where the knee arthritis is so progressed that it can't be helped, and this joint replacement is absolutely necessary. But like I said, for more than 9 out of 10 people, it can help tremendously. I've seen it happen. And if you take that pressure off your joint, even if you're 75, 80 years old, definitely if you're in your 50s or 60s, you can make your knee healthier. It is not age-related. So get these beliefs out of your head. It's not true. And there's research studies that talk about this stuff. They talk about how the likelihood of you having arthritis as you age increases. And we take that as being causal. In other words, like age causes arthritis to happen. But it's not, it's a correlation, which if you think about the scientific terms, correlation does not prove cause and effect. It's just simply saying that as this goes up, this also goes up. Or the tendency is that as this goes this way, this goes that way. This tends to happen, but it's not tying true direct cause and effect. We haven't figured that out when it comes to knee arthritis. We don't know. That's kind of scary if you think about it. Like, doctors are doing knee replacements out there, and we don't know what the true cause of knee arthritis is widely anyways. Like, I'm telling you, I've seen it. I've helped people with the knee pressure issue all the time, the muscle imbalances. I strongly believe that I know the cause of knee arthritis, but it's not common knowledge. It's not mainstream. Number 7, get other muscles strong. And I talk about the glutes a lot because it's the most directly related muscle to getting pressure off the knee joint. But foot muscles are extremely important. The abdominals are extremely important. Even upper body exercises, upper body strength is important. And this is especially hard for the ladies out there to take, because when I see women that are in their 50s or 60s, they're usually like, okay, I need to get stronger in my legs and my glutes. They're happy to do that. But when I progress them farther along through our treatment plan, and they're feeling tremendously better, their knee is great, they're walking as long as they want, they're even lifting weights with their legs properly using the right muscles, then I tell them, all right, now we're going to do an overhead exercise. We're going to grab these weights, do a squat, and as you're coming out of the squat, you're going to raise your arms up overhead with the weights. They're like, that's upper body. And they get shocked about this because they probably have been avoiding upper body exercises for some time. Not all women, but some women do. But what it does to your legs is it causes you to stabilize differently than you would if you weren't using your arms. So I love throwing this in there because you need that in real life. Because how often do you pick up something overhead at home as you're organizing your home, cleaning the home, or maybe at work, maybe you have a job where you're more physical? Like, you need that ability in your life, and your knee and your glutes and all your leg muscles have to know how to handle that. So why not train for it with some weights, especially it's going to be healthier for you overall, for your shoulder, for your neck, as long as you don't have any other issues that maybe we need to address too. But you need strength all over your body, not just the glutes. And this is something that you can't avoid. When I'm talking about the brutally honest truth, like this is something I have to tell people is we're not just here to strengthen your glutes. That's going to be step one, but let's look at your toe strength. I know you're not fond of doing ab work, but we need to do ab work because that's going to help your glutes to work better. And then we need to look at your upper body strength because that's going to make you have a lasting relief for a long, long, long time, indefinitely, potentially as long as you're strong all over. Number 8 is it takes many, many, many reps. I think people always underestimate how much exercise it actually takes to strengthen muscles. Even in the healthcare field, as with being a physical therapist and being around a bunch of other physical therapists in my training, it's a running joke. Like you could talk to any physical therapist. If you ask them how many reps and sets, they just reflexively say 3 sets of 10, 30 reps. It's always 30 for some reason. Variations like that. And what they're not thinking about is how many reps of an exercise is needed to fatigue the muscle, because that's a real goal. That's a real goal. I would say it's not reps as much as it is fatigue. You need to tire the muscle out. If you don't tire the muscle out, then you're not taking that muscle through the process that it needs to go, where it gets used enough for molecules to be released and chemicals to be released to facilitate, to make the muscle get a little bit stronger. You have to tire the muscle out. Otherwise, it is not going to grow in the way that you need it to resolve your knee arthritis issue, to get the pressures right in your knee joints. If you just do the reps that were recommended, 3 sets of 10, even if you were told to do 100 reps and it feels easy for you, like you need to adjust the weight. You need to adjust something about the exercise. It's not always about the reps. You might add more resistance, get a tighter rubber band, get more weights, do the reps faster with less breaks. That can definitely tire you out. There's different ways to do this, but the end goal, it's not the number of reps, it's fatigue. Get the muscle tired, because that's what's going to progress your strength over time. Number 9 is relearn how to walk. So underestimated. Every time I take a patient through this, some scoff. They're like, oh, you really want me to relearn how to walk? Others are stunned. They're like, wow, I thought I knew how to walk. There's all these similar reactions like this where the commonality is they're shocked at how important walking is. Because you walk all the time. You walked to get into this room. You walked to this morning when you got up, and as long as your legs work, which if you have knee arthritis, your legs probably work, it's just hurting your knee. But you walk through your home first thing in the morning and you take steps. But how you accomplish the walking is very important, because you might do thousands of steps in a day, and if it's with the wrong muscles, you're putting small amounts of bad pressure through your knee joint, and it accumulates over time, and that's what sets you up to get worn down cartilage or an arthritic knee joint after so many years or decades. It just reaches a certain threshold where it becomes inflamed, painful, stiff in the joint, swollen, all that stuff. But if you learn how to walk, then you're actually using it to your benefit, because if you're using your glutes properly, if you're using your foot muscles and your abs properly, then you're putting good pressures through your knee joint. And then all those thousands of steps that you take every day can actually become beneficial, because you're using your muscles the right way, keeping them in balance, and putting the pressures through your knee that it's designed to take, so that it's not hurting your knee. It's actually helping it in the long run, as long as it's not in an irritated phase. The next one is related to that, but using the stairs. You may not encounter stairs all the time. It depends on where you live, your home, your work, all that stuff. But a lot of people that have problems with stairs, I can't tell you how many patients I've heard over the years that say, I'm thinking of selling my house because of my knee problem. I can't, my bedroom's upstairs and I hate going to the kitchen. I hate going out because I just want to stay up. Because every time I have to go up and down those stairs, it just kills my knee. I feel like I'm going to fall. It becomes and I can't carry things up at the laundry, doing the washing the bed. Forget moving. Like I'm going to have to hire people. Like there's so many problems when it comes to stairs, but there's a right way to use stairs. And yeah, it's more intense. It's going to put more pressures throughout your whole legs because you have to pull yourself up. It's actually the down part that people have the most trouble with because it requires a lot of control. But if you can learn how to use stairs properly by using your glutes, there's a certain way. I've talked about it on YouTube. I have it in my programs, of course. And if you can apply it, then you can better use stairs and make it work for you, like with the walking, where you're using the right muscles and it's actually going to help your knee joint rather than hurt it. I tell people all the time, you need to learn how to use stairs properly, whether you have stairs at home or not, but it's incredibly more important for those that do have stairs at home, at their workplace, where they encounter it on a regular basis. Number 10 is a cane doesn't have to be for the rest of your life. I bring it up this way because there are times when you're limping, your knee's hurting, you can't be on your feet for more than a few minutes. Going to the store just sounds dreadful for you. Even just walking through the house to do something, cooking a meal, like you're dreading it because you're going to start limping and you know that you're going to pay for it. Your knee's going to just get more swollen. It's going to not feel good. And I talk to a lot of people in this situation. I tell them, get a cane, get a cane, get a cane. And they're pushing it off. They're postponing it. They don't want to do it. There's some that are happy to do it, but they don't want to do it because to them, it's like a social stigma. They're like, but if I accept using a cane, then I'm old. I'm like my friend who looks older. I'm like that person that's older than me that just started using a cane, and I'm not that old yet. They have that association, but what they're not thinking about actively anyway, they're thinking about it subconsciously. I have to uncover this with them, is that the cane is not forever. It often looks that way because you do see people starting to use a cane and then they never let it go. In fact, they get worse. They end up with a walker later on, or a bigger cane before they get to the walker. The reason why that person ended up like that is because they never did the work to take the pressure off their knee and allow the inflammation to go down and get to the point where they can get off the cane. That's a difference. But you watching this right now, you getting this brutally honest advice from me, you're learning a way to help your knee so that you can just be on the cane temporarily so that you can walk and offload your poor, irritated, swollen knee, get around to do the things that you have to do without making it worse. Go do the work that you need to do, strengthen your glutes, your abs, all the other stuff that I talked about, and then get to the point where you can bear weight through your knee, through your whole leg, and it's not aggravating you, and then you can let go of the cane. That's how it should be. It's just that people don't go through that process. They just tend to get worse because they're not doing the right treatment to get their knee healthier. Number 11 is relearn how to exercise. Critically important. You think you know how to do squats. You think you know how to lunge. You think you know how to use a bike. You think you know how to swim. You think you know how to do these things because maybe you've been doing them in the past. But if you're in your 50s and 60s and you've been an active person, and now you're suffering with knee arthritis and maybe even considering a knee joint replacement, you've probably been moving with an imbalance unknowingly for years, decades, since you were a youngster, since you were a teenager in your 20s. And it's just accumulated over time, wearing down your cartilage in your knee joint, causing you to get to this point in life, this threshold where all of a sudden it started to really hurt. Maybe it was hurting off and on. Maybe you knew that if you overdid it here and there, that maybe you thought it's an age thing, but then you got to the point where it's really hurting. And it's been like that for weeks, maybe even months, maybe even years. And you think to yourself, I'm just going to give up that exercise. I'm going to stop doing squats. I'm going to quit walking. There's no way I'm going back to running. Like people say things like that all the time. But in reality, if you fix the muscle imbalances, go through all that work, learn how to fire the glutes, not all the thigh muscles, you can get to a point where you can lift weights again. I see it all the time. I push all my patients in that direction because if we can load the joints properly, get the muscles in the right balance, then you can have healthy joints, including your knee. Most of the time people get to this point where they're lifting weights, but you have to learn how to squat different. The biggest problem with squats is Knees are pointing almost straight forward when they're bending down, and you usually have to move them out. And then the butt goes backwards. Like when people come down, their shoulders come down too much. It should look more like you see all over the internet, like the Asian squat, where your bottom's coming down towards your heels. That is a great way to squat. I teach my patients to squat in that manner. Doesn't mean you need to come to that depth where your heels or your bottom's touching your heels, but if you're beginning to use that form and you're coming down in that direction, even if you come down a few inches and you're using your muscles correctly, you're using your glutes primarily and you're not overloading your knee joints, that is phenomenal. If you can figure out the squat, then figuring out other exercises is easy, like lunges, figuring out how to run and jump, figuring out how to do deadlifts, like serious weightlifting activities you can master and figure out and make it so that it's productive for you, so that it's helpful for your knee joints rather than harmful. But you have to go through that process, and it is a process. It takes some time to figure out, and you probably need some help doing it. Number 12, no one thing ever works. There's no silver bullet when it comes to fixing knee arthritis. There's no single medication that's going to fix it. Like people get in their heads that, oh, the doctor gave me this prescription strength medication, that's going to fix my arthritis. That's not how this works. It's a temporary pain reliever that's just stronger than the over-the-counter stuff. Then they'll think to themselves, oh, the doctor's going to give me this injection. And they usually, I think they get to this point. This is my assumption. It's my thing. Is the doctor probably didn't explain to the patient, maybe because the doctors didn't fully understand themselves, or maybe they just didn't have time because they're so busy. They didn't explain to the patient what the purpose of this is. They're just hoping to put off the pain, temporarily relieve it, give you some better sleep at night. But the doctors themselves are thinking, this is an age-related condition, and once I've given them enough injections and they're tired of it, surgery. We'll recommend that. But they'll give you an injection, and if they don't explain anything, patients leave that appointment sometimes thinking, oh, this fixed my knee arthritis, especially if it was effective. If they leave that appointment and the next, they're sore a day or two, after that, if they're like, wow, my knees never felt so good, literally they think, this cured my knee arthritis. I'm not going to need surgery. I'm great the rest of my life. And then there's zero incentive to go fix the real root problem until it comes back, obviously. But there's no one injection that's going to fix it. Even like gel injections or I forgot the rooster comb, hydro. Oh, I forgot the name. It's slips my mind. But there's the gel injections. They call them gel injections. The idea is that they're supposed to hyaluronic acid injections. They're supposed to like add more fluid to the joint because it's similar to what's in the joint fluid. Like that still does not fix the joint because the pressures are off. The quads are too dominant. The glutes are too weak. It's just a matter of time before it repressurizes again and you're back to square one. It's a temporary solution. Then there's other treatments out there like dry needling and electrical stimulation, ultrasound, shockwave. There's all kinds of treatments out there that are supposed to fix this problem. At least they market it that way sometimes. And there's a lot of healthcare professionals out there that give the honest truth and they're like, this is going to be temporary. But there's no one thing. It's a combination of things. And maybe a shockwave treatment does give you temporary relief, but you still have to go fix the root problem. Maybe that dry needling did help you out. Maybe the injection helped you out for a time. Maybe the pain medication helped you out. Like you have to think, I'm using that to get me to a point where I can go do the exercise. It's not going to fix it though. And then even the exercise, you have to use the right exercise at the right time. It's a process. It's 100 things you have to do. It's not just one thing. And the sooner you can realize this, the closer you can get to solving this problem because then you're not going to give up. It takes grit. It takes some grit to fix your arthritis, but it is possible. I can help you with that. I talk about it all the time right here on this channel. I've got programs that go into it all the time, which by the way, if you haven't yet, go check out our Knee Arthritis Recovery Program. It's the step-by-step process taking you through all of this to fix knee arthritis. I show you how to fix the muscle imbalance. I've broken it up into phases. It is a simplified way to work your way through fixing your knee arthritis. There's 4 phases. The first phase is just getting it to calm down. The next phase is getting the right muscles to activate. After that, we're getting a little bit of strength. And then the last phase is the maintenance phase where you push your strength, but you're feeling so much better at that point. So go check that out. We'll link in the description. That brings me to number 13, which is it's a process. I've been kind of dropping this as I've gone through this. I can't stress how much this is a process. Like people want to just come to one visit with us sometimes and think that it's going to fix their knee arthritis. But I just have to teach you. This is why like I'm not a magic. There's nothing magic in my hands. There's nothing magic about the exercise I do. Like people kind of almost seem let down a bit whenever they look at what we're doing because they're like, "Oh, it's just like the other exercise that I'm doing." And I'm like, "Well, yeah, but that's one out of 100 other things you have to do." It's piecing it all together into the right mix of things. And even then, it's not cookie cutter where these 100 things are going to work for you. It might be, 75% different for this person or 50% different for this person because you're male or you're female or you're taller, you're shorter, you're this age or that age, or your arthritis is this severe versus theirs is not that severe. All those factors have to be accounted for. And the way that I've designed this program, this process is for you to be able to figure out like, oh, this works for me, I'm gonna do it. Or I'm not ready for that yet. There's milestones you have to hit along the way to know, okay, I can go into this next series of things that I can try, treatments that I can try based on my current level. This is how it should be done. This is what I talk about all the time in my treatment approach. This is what's not in the research. This is what most medical professionals out there don't know about because they're going to point you towards medications, injections, and surgery. So there you go. Brutally honest advice if you're trying to avoid having a knee replacement.